Good afternoon, everyone. Thank you so much for joining this listening session today. This listening session is titled, What Upcoming Medicaid Changes Mean for Patients and Families. My name is Melissa Williams, and I am the Director of Grassroots Advocacy and Partnerships over at National Patient Advocate Foundation. And before we get started, we just want to touch on some brief housekeeping items. Please mute your lines when not speaking, and we invite you to enter questions, comments, anything of that sort into the chat, and to please raise your hand to speak when we get to the listening session portion of this webinar. Just also want to remind people that this listening session is being recorded. So we really invite a healthy conversation, but we also want you to just share whatever it is that you feel most comfortable sharing. And before we really get into the meat of the discussion, I just want to go over some definitions, some terms that you all should know. And I also just want to call out that if there is a word or anything that we're saying that's not reflected here that you don't know, please let us know. We don't want any of you to be lost. So we want to make sure we keep our jargon and acronyms in check. So to start, today we're going to be talking about Medicaid and not Medicare, which is health coverage for adults 65 years and older, but Medicaid. Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, aging adults, and people with disabilities. It is administered by states according to federal requirements, and it is a program that's funded jointly by states and the federal government. Specifically, the conversation that we're about to have is focused on a term that has been said around in health policy circles as Medicaid unwinding. So this refers to the process resulting from the expiration of the continuous Medicaid enrollment condition, which was authorized by the Families First Coronavirus Response Act, which was passed in 2020. In short, this means that Medicaid will resume normal operations. In your states, you may have heard this referred to as redetermination. This will be the bulk of our discussion. So we'll talk a bit about what it means to resume normal operations. What are some of the implications of that? How is this going to impact patients? So that will largely be the discussion today. Next, here I have just broken down what CHIP means, which is the Children's Health Insurance Program. You may hear us say CMS, which is the Center for Medicare and Medicaid Services. That is the entity that oversees Medicaid within the Department of Health and Human Services. And then another acronym that we will use, and you might see on the screen, is PHE, which is short for the Public Health Emergency. And so before we get started with this discussion about what's currently happening with Medicaid, we just want to sort of set the stage in terms of why we thought this conversation would be really important. Many of you have heard that the public health emergency related to the COVID-19 pandemic is expiring. And so that means a special program designed to keep people on Medicaid is also ending. And that started April 1st. States can now disenroll people from the Medicaid program and resume normal operations. What this means is that millions of children and adults who still qualify will be disenrolled during this process, losing their insurance and worsening health outcomes. We thought it would be really important to have a conversation about what this means, what questions you have, really have a space for you all to share the concerns that you have in your experiences in your communities. And so this is the point of this listening session and what we will be having future discussions, future listening sessions too, because this is a process that will be ongoing throughout the year. We realize many of you may be learning about these changes to Medicaid for the first time. I am gladly joined today by colleagues at the NPAF team, specifically Caitlin Donovan, who is a Senior Director for Public Relations, Rebecca Kirch, the Executive Vice President for Policy and Programs, as well as Becky Shipp, our Policy Consultant and a former Senate Finance staffer. And Becky, I want to just sort of lift up this point of, what does it mean to resume normal operations of Medicaid? Can you just help us help remind us what Medicaid, how it operated before the pandemic?
Sure. Welcome, everybody. Thank you for taking time out of your busy days to join us here today. And thank you, Melissa, for setting us up. In the Medicaid world, there's a little saying, if you know one state's Medicaid program, you know one state's Medicaid program. When they talk about a federal-state partnership, the federal government provides reimbursement for certain eligible services, but states have a tremendous amount of leeway and autonomy in running their own Medicaid program. They don't even technically have to run a Medicaid program. So there is a great deal of flexibility between states to administer specific Medicaid policy. So a number of states have implemented what's called continuous enrollment, which means when you're enrolled in Medicaid, you kind of stay on for, a couple of years or, until you self-select off. Other states provide different checkpoints for determining continued eligibility for Medicaid. That's a challenge for the Medicaid population because, as many of you know, folks on Medicaid, often move. They have a number of, co-concurrent challenges. It's a challenging population. So in terms of managing an effective public health emergency strategy, it was determined that rather than kind of force these, force these populations to go through an enrollment period again when they were already enrolled in Medicaid, when folks were in lockdown, there was difficulty accessing services, there was uniform continuous eligibility for states, but that is not current law. So what this current thing that's called unwinding is really just going back to current law. So if you're in a state that has continuous eligibility, that's one situation. If you're in a state that has an eligibility redetermination every 6 months, that's another situation. But what we want to stress is that it's going to be a year-long, at least, process moving forward. And it's not going to be like if you were in a state where they have a 6-month redetermination policy and you just enrolled in Medicaid, the rug isn't going to be ripped out from under you. The current law applies. It's like there was this little relief period and now we're going back to current law. But I do think it's helpful to kind of revisit what that means, what the changes mean to vulnerable populations. It will be a stressful situation, but it's not, hopefully it's not going to be a crisis. And we at NPAF are here to work with you and be a partner in moving forward with this. Melissa or Katie, am I missing anything that I should be lifting up?
I don't think so, Becky. Katie, was there anything you wanted to add there?
No, that was a really good overview. Thank you, Becky.
Thank you so much, Becky. And I think you are right. We do not want to be alarmist, but we certainly want everyone to feel prepared. And so I think that is largely the crux of this conversation today. So what's at stake? Between 5 to 15 million people may lose coverage. That is a lot of people. The numbers that we've lifted up here are in the millions. So that's 15 million people will leave based on historical patterns of coverage loss. 8.2 million people will leave due to loss of eligibility, and 6.8 million people will lose coverage despite being eligible. And I think that last number is what's most critical, and those are the people who we don't want falling through the cracks. And to make matters worse, states are not prepared to handle this transition. What we are seeing is that state agencies are facing an unprecedented workload, and they're understaffed. There is a workforce shortage. I think 1 in 4 Medicaid agencies report a vacancy rate of over 20%. So what does that mean for patients? That means as people are trying to re-enroll, that they'll experience higher call times, longer wait times, or other administrative burdens. And this slide here just really reflects how or why do Medicaid enrollees get disenrolled. And I'm going to actually ask Caitlin Donovan to talk a little bit about what procedural disenrollments mean and some of these bullets here in terms of what is it that people will be experiencing if they are currently a Medicaid beneficiary, and what is it that they need to be looking for, and what might happen that could lead to them becoming disenrolled.
Thank you, Melissa. Procedural disenrollments are really what we want to keep a close eye on. And in fact, HHS will be and CMS will be keeping a close eye on as well. They happen when someone basically is still eligible, but they haven't returned the necessary paperwork, or the state hasn't received their paperwork in order to stay enrolled. And this can happen for a lot of reasons. Keep in mind that the Medicaid population is traditionally a population that can move fairly frequently. So maybe their mail goes to the wrong place. English may not be their first language. Often, I think a lot of states are doing their best to reach out, at least using Spanish as another language with most of their notices. But if it's not in their preferred language, the enrollee may not know what's going on, especially because a lot of the people we're talking about haven't had to go through this for 3 years. They may have never gone through this before. So this was something that is a new experience and they may not know to look for. States may be losing paperwork, they'll be behind paperwork. Medicaid runs on a deadline and a strict timeline system. So people will be disenrolled. And this leads to something we also call churn, which is that process of people being disenrolled and then re-enrolling again, which can be very bad for their health. It can be bad for the system financially, and it can also obviously be bad for their finances as well.
Thank you, Caitlin. And we want to just also touch, I know, Caitlin, you referred to the populations who will be impacted, but we wanted to sort of visualize who these people are. So 5.3 million children, 4.7 million adults aged 18 to 34, 4.6 million Latinos, 2.2 million Blacks, and millions of aging adults, people with disabilities and complex conditions. Caitlin, can you say a little bit more about just who else, in particular that might, will be impacted, or who might be at risk of maybe falling through the cracks?
There's a lot of people who fall into these circles already, but we're talking about people who are frequently unhoused, people with complex conditions, obviously people with low English proficiency. A big one we really want to highlight are children for a lot of reasons. One is that children actually have different eligibility restrictions than adults do. So frequently what will happen, and what we're really worried about here, are that parents will be told that they're no longer eligible and will assume that their children are no longer eligible as well. And that may not be the case. So those children will get lost as this goes on. There will be people in rural populations, depending on the state restrictions and how states go about being enrolled. They may have a hard time with people without internet or good Wi-Fi capabilities, people with low tech who aren't tech savvy. There's a lot of people who one way or another are going to fall through the cracks here. And that's why we're glad you're all on this call.
Absolutely. And I think another point we want to touch on is because Medicaid is administered by the states, that things are going to look differently depending on where you live. And so, Caitlin, I was hoping you can maybe talk a little bit about some of the information that you've come across as you've sort of been looking into how different states are implementing this guidance. And we also just wanted to call out specifically the 50 state unwinding tracker that was put together by Georgetown University Center for Children and Families. It is such a helpful resource. We'll share the link so you all have it as well. But Caitlin, yes, if you can just say a little bit more about this, I guess, further complexity in terms of what happens in different states. And then Becky, I'll have you add as well.
So what we know is that there are certain guidelines that all of the states have to follow during this process. For instance, we know that CMS wants them to only disenroll, have those procedural disenrollments about 1/9 of their their Medicaid population per month. So what CMS does not want to see are a dump of 400,000 people all of a sudden off of the Medicaid rolls. And they're going to be watching that closely. We also know that they cannot change their guidelines for eligibility, and they cannot change their benefits during this process. So that will stay the same. I know we had questions about behavioral health. That being said, there are going to be differences in states, and that's going to have a lot to do with how the state runs its Medicaid program to begin with. We've seen some of the disenrollment letters that the states have started to send out. Some states started in February. There's 9 of them. Some states are going through the process much more slowly. So for instance, we saw Oklahoma's letter. Oklahoma started off telling people that they will be disenrolled. They are no longer eligible at all, but that they would have to wait till the second letter to actually log into the system. And then there was going to be a third letter, and that was when they would find out why they were no longer eligible. And then with the 5th letter, maybe they could log in and try and update their information because maybe they are actually still eligible. Whereas we saw Arizona's letter, and it was much more focused on letting people know immediately what they could do, and had both languages of Spanish and English available. The best way, if people are curious to know what's going on in their state, that tracker that Melissa has up on the screen is a really great resource, and it has every state there. It has the state communication plans. It has social media that you can use with images to get the message out. And you can take a look at their general plan for the unwinding process. That being said, I want to discourage you from thinking that you're going to get a really detailed plan because it's not great. It can be a little bit ambiguous because the states themselves don't know exactly what their numbers are for how many people they will be able to track down, and how many people will be submitting and in what month. You can a little bit assume that if you have been on the Medicaid program for 3 years and have never gone through the process before, and you don't fall into you haven't submitted any paperwork recently, that you might be contacted more quickly, more than someone who maybe just went through the enrollment process a few months ago.
And Becky, jump in.
So yeah, thank you. To highlight what Caitlin pointed out, it's going to be different in every state. Some states will have continuous eligibility. Some states have different time points for redetermining eligibility. Some states will try to transition folks that had been on Medicaid that were currently not eligible for Medicaid into a state-only program. The point of this exercise is to let you know at the very beginning kind of what's out there, so you can communicate with Melissa and Mary and your NPAF team of grassroots organizers to let us know what's going on at the local level and how we can help you get the word out. The worst thing, the thing that everybody's the most afraid of, is somebody showing up for a doctor's appointment and realizing that they don't have coverage because they never got the letter, they didn't understand the letter, they had moved, the letter went to the wrong place, they didn't understand the redetermination policies. So this is the sort of the purpose of this, and to emphasize, it's going to look different in all states. Hopefully, as we discussed, this is a year-long, process, maybe longer. Hopefully the trackers will get better. Hopefully the word will get out. Fingers crossed that this can be as not seamless, but as not as painful as some folks are worried about. I saw a question in the chat about the dual eligibles. Yes, if you are a so-called dual eligible in a state where you have to, redetermine your eligibility for Medicaid, not Medicare, you could be impacted. Any Medicaid enrollee, because to be enrolled in Medicaid, you have to go through one of a variety of pathways, but there's usually an income component, and you have to document that. So yes, duals could be impacted. I see another question. What's the anticipated impact to providers, hospitals, clinics? Again, we are really in uncharted territory. Sometimes it's okay to say we don't know the answer. This is the purpose. This is a listening session, not a briefing. So, we don't know. States don't know. It's unclear. As Melissa indicated, if 15 million people, for a variety of reasons, lose their coverage, there's certainly going to be implications to providers and clinics. Hospitals may be a different story. At this point, nobody knows. So there may be folks that are providing types of economic analysis. That's human nature, to try to figure out kind of what the implications. I take those with not a boulder of salt, but maybe like a snowball size particle of salt.
Thank you, Becky.
I will put in a plug that under the recent, as far as the dual eligibles, I know there are millions of people who will transition to just being eligible under Medicare. If you are one of those people on this call, you should look into different Medicare programs that will help you with your out-of-pocket costs. Those were recently expanded under the Inflation Reduction Act.
Thank you, both Becky and Caitlin. And here we just sort of put a finer note on the point that Becky and Caitlin emphasized, that this, we're really at the beginning. We don't know a whole lot yet. And this is a year-long process. States will have until May 2024 to complete the redetermination process. And that said, HHS Secretary, Health and Human Services Secretary Becerra has new enforcement authority that if there are too many procedural disenrollments, and Caitlin or Becky, I don't know if you want to add any more around that regarding how states, or if states, will be held accountable to stick with their plan, because we know there are reporting requirements.
So that, yes, there are a couple of ways that the CMS is tracking this. So right now, the reason that states were not disenrolling people from the Medicaid program is because they were getting extra funding. And in many cases, that extra funding more than made up for the cost of those extra people on the program. And it's not all going away at once, it's gradually reducing through December. So while that is happening and while they're still taking those funds, CMS has enforcement authority to make sure that they're still submitting accurate data, that they're not disenrolling too many people at once, and they're not disenrolling too many people for procedural reasons. And that they're also doing things like committing to proper outreach, not just sending, for instance, one notice in the mail and not trying any other. And that enforcement authority can just be stepping in what I called a performance improvement plan, that he could do that, or all the way to halting the unwinding process. I think Becky and I both agree that that would be a pretty extreme and unprecedented step for the secretary to take, but it is within his authority at this point.
Yeah, and we also, I mean, I'm going to mix a bunch of metaphors here, but it is kind of like they're building the plane as they're flying it, kind of. Nobody knows. They haven't set out like, okay, if this is the tripwire, then this is what's going to happen. Which is why your stories and your input are so critical. So there you go. So we can know. But the process, again, and here's where I'm mixing up the metaphors, the process is going to be like trying to turn around an ocean liner middle of the ocean. You can do it, but it's really complicated and slow. So, again, just to repeat, this is why NPAF is starting this process now, so that we can be, stewards of, clients that will be affected and be able to kind of get the word out. And if there are issues that are acutely problematic, we can then, as your advocates, bring this to CMS and others to help inform this process.
Exactly, Becky. You said it just very well. And I'll just underscore again, this is why your stories are incredibly important. And we are going to build a feedback loop and develop a process with you so that your stories can be heard, that they are channeled to the appropriate entities who can hopefully make the process better, or build resources that could help alleviate any issues that might be taking place where you live. So Becky and Caitlin, thank you so much for your beautiful brains and input. This was really helpful. I'm hoping others agree, but we want to turn the discussion now to the main point of this listening session, which is to hear from all of you. We want to hear any reactions you have to what has been shared. We, again, understand that some of you may be hearing about this for the first time. Some of you might not know what's happening, and that's okay. We want to hear that too. But we have included just a couple prompts here to sort of guide the discussion. So you are welcome to answer any of these questions here. We just ask that if you want to chime in, to just please raise your hand and I will call on you. And when you begin speaking, please introduce yourself, name, location, and group affiliation if you have any. And some questions that we've added here are, what are you thinking about doing to help people in your community understand these Medicaid changes? And what resources do you think you will need to effectively monitor this ongoing process and communicate with us? So with that, I'm going to stop talking and see who all would like to contribute to the discussion.
Melissa, I think there's a comment in the chat. Let me put myself back. Is NPAF collaborating with other advocacy organizations in providing resources? I think the answer is that because this is like, we are at a beginning stage here, it would certainly make sense to work with other patient groups. There are a number of organizations tracking this. We can make that available. You saw the Georgetown link. There's also Kaiser Family Foundation is tracking this. The federally authorized organization called MacPac is tracking this. You know, I'm a big fan of, if other people are doing good work, that means one less thing for me to have to do. So we can certainly make these resources available to you as part, and I think we're doing that as part of the toolkit, right? Okay, perfect.
Yes, we will share all of these resources. The ones that we've been looking at that have been helpful to us, we will make those also available to you all. But yes, thank you so much. And please, please unmute or raise your hand if you want to contribute to the conversation. If it's okay, I am going to actually stop sharing so I can actually see hands that come up. And Adrian, please go ahead.
Sorry, you guys. Can you guys see me?
Yes,
I'm on I apologize. I'm on my phone, not my computer.
It's okay. We can see and hear you.
Okay, great. My name is Adrienne Carrier. I am an RN. I'm a board certified patient advocate. I run my own business. I'm also on the board of Pulse Patient Safety Education Advocacy, and I'm a social media creator. And I'm part of a very large group of nurses on social media who are making content. And I want to be able to encourage other nurses and other creators in the healthcare paradigm to make content about this, because we are all spread out all over the country. And, you know, one thing that would be helpful is to have, you know, some talking points. And I'm thinking about this as I'm listening to everything you're saying. And I did policy work prior to starting my company. And, you know, what I'm thinking of is, you know, making some of those bullet points or, you know, resources. Here's some resources, like if it's Georgetown or whatever it might be. So I would encourage other people to do that. And so my handle is Nurse Adrienne RN on TikTok and Instagram. So as soon as I get that made, I'll post that up as well in my link tree on my social media, which will probably be in the next 48 hours. Because I think this is something very important. A lot of us have been talking about it, us being people on nurse creators on social media, and really, you know, kind of like, wow, what's going on? So very much appreciate the work you guys are doing. Obviously, you guys know about us at Pulse, the work we do. We more focus patient safety issues, but right now, I think, you know, it's such a huge issue, right? We're talking 50 states where there's no one organization that could just do it all, right? Or even pieces and sections of it. So I think the more that we can collaborate, the better. And I look forward to doing that with all of you as well, you know, from the perspective of being on the board of Pulse and as a private patient advocate. So thank you guys for doing this. Really appreciate it.
And I think that's also an amazing point, that providers are really a key part in this whole process. I know some states have it in their plan specifically to try to alert providers if someone is on Medicaid, that person might need to update their paperwork or whatever it may be. I don't think all states are doing this. So as much as providers, if you're on this call, can be aware of what's going on and encourage any patients who may or may not be eligible for Medicaid to update that paperwork. That would be wonderful. It's a really important work. Thank you for what you're doing.
Thank you so much, Adrienne. I think the suggestion of just talking points to help you would be great. And yes, drop your handle in the chat, because we will want to give you a follow and see what we can do to lift your content up as well.
Thank you. I appreciate it.
Thank you. Any other comments or questions people have? I'm
Food
seeing,
banks.
what's that?
Said food banks. I love, I mean, all of the, this is when we go back, and Rebecca Kirch is great on this topic, but that entire public and private social safety net, food banks, our navigators out there, all of the work everyone is doing to support everyone, because, you know, there's a really big population of the Medicaid enrollees who are food insecure, along with housing insecurities. So those are real assets. I know Ohio, I believe, is working formally with their major food bank, I don't know what the right word is here, to reach out to people and get that notice out. If anyone out there also works with food banks, one of the things that we can do, and you can check from the 50 state tracker from Georgetown that has those communication links, going to those community spots too, especially places like food banks, if you are a member of a church, that will let you put something up on the community board, even coffee shops, to get that information out to people. Those are really good spots. I know people on this call are really good at just that, you know, feet on the ground, getting out the information. So if you can do it, please do.
One thing also to be aware of, in some states, not all, but in some states, there's a provision called express lane eligibility. And what that means is if you enroll in one public program like food stamps or cash welfare assistance, otherwise known as TANF, you are automatically, they assume that you meet, like if you're eligible for the temporary assistance for needy families or the cash welfare program, you're going to be eligible for Medicaid. Okay, the income eligibility for both are, TANF is a much lower income eligibility than the eligibility for Medicaid. So in some states, you'll just be, once you're enrolled in TANF, or in some states, it's TANF and food stamps, otherwise known as SNAP, you'll go right on to Medicaid. So some people may be enrolled in Medicaid without knowing it. So as we begin to kind of, you know, work through these issues, be aware that, like I said, in some states, not all, if you sign up for SNAP, and, you know, folks that you work with in food banks and other issues addressing food insecurity should know that this may be a way to kind of help manage through this population through these next months.
Thank you. Thank you for that. And I want to just sort of lift up a point. I think I've sort of seen it in, I think in one of the comments in the chat. How does this impact states who have not expanded Medicaid? Caitlin, do you want to weigh in?
Well, the thing about what was happening during the COVID public health emergency, it wasn't that states necessarily had more people who were now newly eligible for Medicaid so much as they weren't kicking people off the program. So those states that haven't expanded, they're going to be in the same place they were in 2019, basically. Obviously, we still have, that means we're going to have a lot of people who are falling in the cracks. They're not going to be eligible then. So often for marketplace supplements, I'm using the right words. It's the end of the day, guys. So that's one of the problems we're facing, is that they're not going to have enough of an income to get marketplace supplements. A lot of the people, about 1 million people who are no longer eligible for Medicaid, will go to the marketplace, but there are people who are going to be lost, and we're looking for them, and we're going to try and help. Your spouse and children, should they be eligible too? It is an income by household. Like I said before, children generally have a higher income level that they can use to determine eligibility. So hopefully they could still be eligible even if the parent isn't.
And sometimes some of these children in families that may not be eligible, some of the children may be eligible for the children's health insurance program in that state. So be mindful of that. Parents, and this is where it does get confusing, parents are not eligible for CHIP, but some of the kids in households that may be deemed ineligible for Medicaid could be eligible for CHIP.
Yes, thank you. And I just want to repeat the question because it did come into the chat for the recording. The question is, what about your spouse and children? Should they be eligible too? And Mary, Rebecca, I know you are also monitoring the chat. I want to just see if there is any point that ought to be lifted up to bring to the larger discussion.
Not seen
Well, I'd love to do a pitch because one of the nurse Adrian just pointed out that this is going to impact food insecurity, which is a really great point. I would like to point out to everyone on the patientadvocate.org website, we have the National Financial Resource Directory. It's just been updated. So I think it's live now. The updates are live, if not by next week. And you can go on there, put in the state, a diagnosis, and if you're looking for nutritional assistance or whatever you're looking for, transportation, childcare, whatever it is, you can go in there and it will populate a list of those resources. You can click, call directly from the website. You can print it out, whatever you need. It's a really, really great free resource, and I encourage everyone to spread the word about it.
Yes, thank you, Caitlin. The National Financial Resource Directory is an incredible resource for sure. I'm going back into the chat and I'm seeing that there are suggestions for a one-pager that people are looking for to hand out or email at community meetings and events. I think that is certainly helpful, and that's something that we can help support. I think I saw a couple comments around that.
And with that,
Reaching out to your state representatives if this matters to you, and it should. That's why you're here. Reach out, let people know the beauty of being involved on the state and local level is that you are in a place where your voice can be much, much louder. You know, and the expansion is still going on. Is it South Carolina that just recently expanded their Medicaid program?
I think North Carolina.
North Carolina just recently expanded their Medicaid program. The momentum is there. Be involved on that local level, find local organizations that are working on these issues, and please get involved. Stay involved with us. We're here to help you there too. But the caring about these issues, I think, is at the crux of patient advocacy. And so we're thrilled you're all here.
Yes. And Rebecca, I know you've been trying to get a word in. Please go ahead.
I think I just simply wanted to reinforce the opportunity for us to help support the story gathering and sharing with the right receptor sites for action, whether it's at the administration level or CMS or with the state legislature. So you are not alone. Those of you are helpful in sharing what you're hearing on the ground. If you haven't heard it yet, now your ears are perked because of what colleagues, the team here talked about today. But I think a big opportunity for us collectively together is to gather what's bubbling up over these next months. One story can matter a great deal in terms of helping to make sure that states are behaving appropriately and to celebrate where that's happening, not just the bad stories, but where states have done something right. In the chat, we saw an example in Texas where a person actually was confirmed to have coverage. Now we don't know what happens later, but those who are more newly enrolled recently may not be impacted by these changes at all. It's those who were enrolled during the COVID pandemic who are potentially most at risk. So we just want to kind of keep watch. And it's uncomfortable, this process of uncertainty, but it's one we as a community have been through time and time again. And when we collectively share information, as we'll set up the infrastructure to do here, both in terms of tools for you all, as you've asked for, but also the place to collect information and share intelligence as stuff starts to happen. I think that will be really critical, both for helping media become involved and understand. Many think this is a one and done moment. Even that is misunderstood. And that this is a process that will continue to happen, and the implications of it will roll out is something that I think all of your voices will be critical to help sort of amplify what we know about what people need and to make sure that those needs get met.
Thank you so much, Rebecca. And I see Tony K has her hand up. Tony, please go ahead.
Yeah, I don't know if this was already mentioned, but I'm just wondering for individuals that have like county caseworkers assigned to them, do they have to worry about this as much? Like, I'll just give a couple examples. People that have a developmental disability or people that have a physical disability and they're assigned to a county caseworker.
I've seen some of the plans from some of the states, and generally those are not a population that are earmarked for immediate focus, is the short answer to that question.
But I would also, and I agree, I would also, though, I do think at least for the next couple of months, we should not assume that folks are aware of this. So they may not know what they don't know, which is why we're coming in early. I am hopeful that they, within staff, within states, that they will be briefing the staff on how to do this. But what is it, trust but verify kind of moving forward. And don't just assume that because they have an individual caseworker, that caseworker is up on all of the intricacies of the state process to address this eligibility issue.
Yes, I think you all have critical roles as advocates to be sort of a liaison of sorts to share this information that we talked about with providers, with Medicaid enrollees, really letting them know that this is coming. If it hasn't come already, it's coming down the pike, and what are some things that they can do to be prepared. Let's see, I saw a question in the chat from Jacqueline who asked, what is out there for people who are illiterate in terms of resources? Do we know?
All of the states have centers to call. I think that hits on a particularly vulnerable population because right off the bat, they'll probably not understand the request for them to update their information to begin with, let alone what the phone number is for. So that's a really difficult practical question for which there's no happy answer. It's a high priority population. I will say there's organizations like Patient Advocate Foundation, there's the state affiliated groups, there's other charities that help people through the Medicaid enrollment process. But in order to get them to those organizations, we have to know about them first. And that's the worrisome thing here.
Tony, please go ahead.
Yeah, just a comment for that. My understanding is that all states have centers for independent living. So is that are those groups that have been connected? Because, for people that can't read or people that have vision issues or hearing issues, do you know if they are doing a lot of outreach in all 50 states, the centers for independent living?
So I'll take that and just respond with one of our themes. Some states run really smart, progressive, comprehensive CILs. Some don't. I hate to keep saying like it just is going to depend on your state. And which is why you on the ground are so critical to this process, and the ongoing exchange of information is so critical. It is really just, it runs the spectrum, Tony. I wish that there was more uniformity and more consistency, but that's just not how the program operates.
Yes, and I think that's such an important point because we are we are very much at the beginning of this process. And I think sort of a point that I think Rebecca had mentioned earlier, with us coming together to have these conversations, to share what we are learning, to share what are the best practices that are happening in some of these states, and maybe advocates can bring that to other states. That's really important, because we want to highlight the good and the bad. And so this is, again, we know we're just starting off, and we'll likely have, not likely, we will have other listening sessions, because this is an ongoing conversation. As we indicated, it is a year-long process, and people are just learning. And you all as advocates, as those boots on the ground, have a pretty special role in getting the word out there. Are there any other comments, questions that need to be lifted up to the larger group? All right, I feel like we are sort of coming to a point where we can maybe wrap up this discussion. Rebecca Kirch, I would like to turn it over to you just to share some key takeaways and some other points that I think sort of bear lifting up.
Sure. Thank you, Melissa, Becky, and Caitlin, and whole team, and all of you who tuned in today to start this experience with all of us. I truly believe that there's so much power in the people when we're facing an unknown of this sort. And I think one of the key aspects of what we'd like to do is make sure that we're responsive to the needs you have to be those messengers in your communities, and also the ears on the ground to report back to us. So what we do know now is highlighted in the bullets of the slide. So I'll just touch on those lightly, that the interruptions, we know they're coming. We don't know exactly what it's going to look like. I wish we could, so that we could issue a toolkit that says, if this, then that. We're not in that place. But we will probably start to begin to get there, especially with the information sharing that will continue through these listening sessions across the course of the year. There's the potential for many people who are eligible to lose their coverage anyway for procedural reasons, through certainly no fault of their own, and really through no fault of the state offices who are administering Medicaid on the ground, but because of this change, reverting back to what we were before pandemic. And so we want to be mindful of helping people to understand you may or may not be getting a communication that explains what's happening here. And we don't know what level, in different states it will vary, what level of help is going to be available. We also know there are colleagues on the phone here, we've heard from some of them, and out there in community health centers, in patient advocate foundations, direct patient services, the Financial Advocacy Network for those who have cancer that ACCC runs. Different people are trying to prepare. And so for us to band together to help be that extra layer of support on top of what the state offices are doing is going to be an important aspect of what we all help to make happen. And I think, as it's bolded here for emphasis, that opportunity for each of you, whether you're a patient, a caregiver, an advocate, a practitioner in this field of helping support different versions of navigation that we know is so incredibly important. For all of us, we have, I think, a responsibility to do what we can to help share information, cultivate really helpful resources, and come back together both to share information, maybe even commiserate a little bit, but also to celebrate where wins happen. Because I fully anticipate, as we said, when things are this uncertain, there can be good, bad, and ugly all at once. And so I think that's sort of the takeaway here, that let's not despair, let's be aware. And this is that opportunity to sort of really hit the ground running with, here's what we know, here's what we don't, and try to invest in being comfortable with that uncertainty while we're developing the tools that you've all asked for, and continuing to set up that infrastructure for info sharing, starting with email communication following this, starting with the next listening session, which will probably be in just a couple short months, because we're going to start to see some impact here, right, Becky? That's, what we're looking at. And to make sure that we all have opportunities to share the bits, the resources, and the toolkit.
Thank you so much, Rebecca. That was all beautifully stated. And so I'm just going to emphasize some of the things that Rebecca noted in terms of what are things that you can do right now. And we will share a copy of this deck. We will also share a lot of these links so you have access to them. I know Mary has already been populating the chat with many of them, but start with educating yourself about what's happening in your state. We talked about the 50-state unwinding tracker from Georgetown. Of course, look at your state's Medicaid website. And if you see that maybe your state is falling behind or should be doing more, let us know, because we can help amplify your voice to call that out. And then I think what I've sort of seen in the discussion here is this desire to spread the word and share resources that will help Medicaid patients and enrollees. And so again, Georgetown has their tracker with specific outreach materials that, again, social media content specific to your state. And there may even be one-pagers for each of your states that are within that tracker. So we'll do some of our due diligence to lift that up so we don't have to reinvent something that's already there. CMS also has put together their own communications toolkit. So if some of you are ambitious and want to hold your own information session, they include that template deck that you can use to sort of enter in the information from your state. So that's already made. And then our partners, Young Invincibles, also have put together a really great toolkit. And again, we will share these links with you directly so you have them. And then lastly, the point that we've been emphasizing here throughout this listening session is sharing your experiences with us. Your stories are helpful, so helpful. They're data points that we need to collect so we can build additional resources that you need. We've, of course, have outlined some of the resources that are out there right now, but there may be others that haven't been made yet. And we have that opportunity to build those resources with you. So please let us know if there's anything else that might be able to help you better your outreach or better communicate with the people in your community. And so, as we've noted, and I'll just repeat again, our next steps is to host more listening sessions, and we'll send an email with some of those dates, as well as some of the resources we talked about today. We'll start rolling up our sleeves and getting to work on developing and sharing tools based on the conversation that we had today. And then we'll set up a communication platform so you can share your stories with us, but also with each other. And I think I just want to end by thanking my colleagues for being here and helping facilitate this conversation. This was really, really great. And this is the first of many. And then lastly, just want to thank all of you for tuning in, showing up. Showing up is the hardest part. And so we really appreciate your time this evening, and we hope this information was helpful. Please let us know if there's anything else, again, that you might need, but really, thank you so much for your time. I'll keep the slide in the chat open in case there are a few outstanding comments, but we'll end here. Thank you all. Have a great rest of your day.
Thank you very, very much.
Thank you.